So what if someone came along and asked you to work with about 80 individuals who required 9 medications per day, given at 4 different times of the day, needed total care, needed assistance with eating and dressing? Well, welcome to long-term care. I'm David Klein. I'm the president of Saskatchewan Registered Nurses Association, and most of my career has been related to long-term care. I started out working as a special care aide. We often think of long-term care as being routine, and I think it's anything but routine. It's exciting. Long-term care isn't all elderly people. Our long-term care in Saskatchewan is certainly changing. We have many young people that require care as well. So it's a great place to be, and I would certainly encourage anyone that's interested in long-term care to look at that as a career.
The long-term care focus is not our frail little elderly people anymore. We're looking at a lot of younger individuals. It's definitely a challenge looking after people with acquired brain injuries. You try to make it more like their home rather than in an institution, and that's been a real challenge. Treating them like they're individuals. They've got a lot to offer with regards to life history. They're usually there for extended periods of time, so you can really develop a relationship with them as individuals rather than treating an illness. You treat them as a whole person, and trying to make a difference in what long-term care was and what it should be with regards to medications, restraints, those kinds of things. I don't know, a lot of people think that it's not a specialty, that it's boring, but I certainly don't find that. I think working long-term care is definitely a specialty because their needs are unique. It's just different. I really enjoy it. I never thought I would when I started nursing initially, but I certainly do now.
Well, I'd just like to say that I really love my job. Our elderly have such a vast store of knowledge, and they're very interesting. They have so much history to share, life lessons to share. For me, it's exciting also to know that I can make their moment just by being there for them, by singing a song, by holding their hand, by giving them a cuddle, whatever. You can make their entire day just by doing that. Oftentimes we become their advocate, their representative to their family. Communication with their family members is so important, with spouses, with extended families, reassuring them that their loved one's being cared for in the best possible manner, and that their fears and their worries can be alleviated, that they're not denying their family by putting them in a long-term care facility, but we're there for them, and they can be there for them as well. The elderly are sometimes very challenging to treat clinically. I find there are a vast array of medical and physical disabilities often makes treatment difficult. Watching for side effects, perhaps changing treatment, alerting the doctors to need for change of treatment. I find that the elderly need a more holistic treatment. They have physical, spiritual, emotional needs that need to be met, and they have limitations, many limitations placed on them, but we need to maintain their quality of life, and we can best do that by not only maintaining their independence, but also making sure that they're safe and their dignity is respected.
I finished in December. I fast-tracked, and then I did the mentorship program here in long-term care. It was difficult initially just because there is, for example, special care aides that have been here for 20 years, whereas I'm a new grad and just starting out, so I think they find it difficult. that someone comes in who is almost like in charge of them. And so I think for that reason, some of them find it more difficult. So it's very important like to have good communication skills and to build a rapport with your staff. I think people have that misconception about long-term care. It's basically here is like a general medicine unit. You use all your nursing skills that you've learned throughout school because there's always seems to be something different that comes up in long-term care, whether it's pneumonia or whether the resident has a UTI. You need all the assessment skills that you've learned. Well, I have to know medications, that is very important, and I'm glad I have my PDA to look up things like that because I feel like you have to be so many different roles here.
My name is Doreen, and I'm the facility manager at the PAPHR Special Care Center. When I started here in the dietary department, it gave me a chance to see all the different people that were involved in long-term care. It wasn't only just nursing. There's a whole variety of aspects involved in long-term care, and we work together as a team. There's housekeeping, there's dietary, laundry, maintenance, activities. Long-term care is a community. It's not just people coming and this is where they stay until the end of life. We become a community and a family here. So we really become involved in each other's lives. Father's Day isn't just Father's Day for my father. Father's Day is for everyone in this facility then, and we recognize them. Long-term care residents are very, very special people, and we treat them as if they were our own family.
My name is Ray Pickard, and I've been here for 2.5 years in this facility. I either put jigsaw puzzle together or we play games. If not, I can go for a ride on my scooter. And if not, I can watch my hummingbirds. And I kind of look out for the other patients because some of them, they will not speak out for themselves. So if I see it, they need something, I'll see if they get it. And I'm doing something for somebody. As long as I can make them happy, it makes me happy. That is everything. And as far as I'm concerned, it's a great career if they want it, but they've got to get along with the elderly people. And I think that's the main thing. The most important is to have a sense of humor, because we're going to razz them.
I've just noticed throughout my nursing career, and noticed especially since I've been observant of staff and the residents' lives in long-term care, that it's very nice to have the mix of staff as far as ages, genders, to complement the workplace. They complement each other. I was a small town rural nurse initially when I moved to Saskatchewan, and then moving to Prince Albert I worked in minor surgery for 10 years. And then I worked at Saskatchewan Penitentiary for 5 years. The variety of areas that I've nursed, all those areas have provided me with experience to bring to long-term care. I moved first to Saskatchewan in '93 after I completed my nursing studies. Yeah, been here ever since. I think work life and home life are both very important. You spend a lot of time at work, when you're not at work, you want to be in a place that you enjoy living. And Prince Albert is excellent because it's small enough that you still have the quality of life. You're not living it out of your vehicle. You still have a very good quality of home life because you are able to be there when you're not at work. Within 10 minutes anywhere in the city, you're home. Prince Albert also offers everything that your children need as far as sports, recreation, arts, culture. We've got everything, and we're very close to the lakes. So if you enjoy that type of thing, which we do, one of my favorite things about Prince Albert is how close it is to Candle Lake. You can be there in less than an hour, and it's just, I mean, my sister from Alberta comes to visit every summer. We go up to Candle Lake. She said, "This is my Hawaii." It's awesome. It's beautiful, and that's not the only lake around, but it's the proximity from where you live and do your work. It's so accessible. It's amazing where you go. You don't go anywhere in Prince Albert without really running into somebody that you know. So it's small enough. Class sizes for your children are small enough. Sports are easily accessible, and the people are great. It's a very dynamic group of people, a variety of ages, lots of young people in the area, and I think they all contribute to make PA what it is.
Did my training in Alberta 31 years ago. I've mostly worked in acute care, and I have come back into long-term care after 30 years. As a semi-retired RN, had enough of acute care. The pace is too much. I'm looking for a slower pace, but not less of a challenge. For new nurses that are looking for a challenge, long-term care is your place. You are responsible for the holistic well-being of those patients, residents, clients, and their families. And a lot of times you take care of the families more than you do the residents. Long-term care has challenges that are unique to it, other than acute care. Acute care people are in, fixed, and gone home. Long-term care has the privilege of getting to know people, their histories, which is fascinating, all about them, their little quirks, what makes them special people. You don't get that privilege in acute care. So I'm really enjoying my return to long-term care. I guess those are my wow moments. I get to be an active part of someone's history and end-of-life decisions. I think it's a great place to work. I have a little box with people's obituaries and little things that they've given me. I had a gentleman give me an ECG strip one time, which I kind of looked at and went, and his wife said he wanted you to have his heart.
I think it's really important for people to start thinking about long-term care as a viable career option, because there are so many different things that you can learn. There's all the chronic disease language. I mean, you can talk about diabetes, hypertension, Parkinson's, you name it. I mean, that you will find in long-term care, and that's a good opportunity to learn those skills. And especially in the elderly, there are so many different things that you can do. There's different types of wound care that you can learn. There's palliative care, which is so important, and so important for people to assist families with their loved one passing on, and is one of the most honorable things that a person can go through. And when you can assist a family and a patient to go through that, I think that is one of the most important things that you can do in your career. And I think this region offers so many different places to live. You can live in rural Saskatchewan. You can create your own dream of living in a home, on which I did, which I live on a home on top of a hill overlooking a river. And you can move out here and have career options. It's not a career ending opportunity, it's a career beginning. And for me, it's been one of the best things I've ever done for my career. I think with all the beautiful lakes and trees and wildlife and I'm an avid gardener, and if you love gardening, this is the place to do it. I think if you're a single person looking to find a place to belong, I think this region, this part of the country is one of those places, because people really take the time and opportunity to get to know you. Small town Saskatchewan is very vibrant, and we have opportunities to get together and to be part of a group, and we have slow pitch tournaments and hockey tournaments, and you don't have to be good at any of them. You can just take part, because it's an opportunity of a lifetime to come and work in our region.
Hello, my name is Rosalie Longmore, and I have been a registered nurse for 34 years. My clinical practice has all been in long-term care, although I've been the president of the Saskatchewan Union of Nurses for the last 11 years. Nursing in long-term care permits one to interact with the resident and often their entire family. Staff and residents often become like a family as we share important events in our lives. There's opportunity for professional development and career advancement through nursing in long-term care. I encourage everyone who has an opportunity to try it. It may be an exciting beginning for your career in nursing.